a person who is 18-year-old, because of the hair fall, he can actually look like a 40-year-old. So it's very depressing for such young children who are going in college and they're having, it has a lot of psychological impact. PRP is something which we call it adjuvant therapy, where we, even if the patient is undergoing hair transplant, we always accompany PRP session pre and post. This is a product which contains a lot of growth factors, which is injected onto the scalp.
We are here sitting with Dr. Rashmi Sharma here today of Fortis, and she is going to take us through the latest revolution in hair treatment called hair PRP.
So PRP is basically a growth factor concentrate which contains increased amount of platelet in the low amount of plasma. So basically low volume of plasma contain increased platelet concentrate, which is about 5 times the normal blood value. So this is a product which contains a lot of growth factors, which is injected onto the scalp, and then it stimulates your hair follicle cell, and it acts like a stimulatory effect on the hair follicle, and you see increase in the density of the hair as well as increase in the count of the hair and increase in the thickness of the hair. So it has gained a lot of popularity, especially after post-COVID hair loss, when people were suffering from hair loss and a lot of stress was going on. So because of post-telogen effluvium, telogen effluvium means basically when you have a hair loss because of acute illness. There are preformed tubes available now. So the kits have actually made it very easy. So you take out the blood sample from, it is autologous, so you have to take from the patient's own bloodstream under sterile precaution, and these are sterile tubes. So these are, the blood is then transferred into these tubes. So if you can see, there are different tubes available. So we take about, the strength is 5 ml. So we take 5 ml blood in each, and about, so you need to withdraw 20 ml. So we transfer this with by taking out the blood, we transfer this into these sterile tubes. So this is a more of a closed circuit. So there are least chances of any infection. So this is transferred into these tubes, and then we run this into the centrifuge machine, and then we get something called as platelet-rich plasma, and that is then injected onto the scalp. Basically, we separate the component of blood depending upon the specific gravity. So platelet being lightest of all will concentrate on the uppermost layer. So lowermost layer will be your RBC, which is the heaviest of all. Then you have your WBC, then you have your platelets. So what we are concentrating here is on platelet-rich plasma. If you see male pattern of baldness, there will be receding lines around the, on the sides of the scalp. In female pattern of baldness, what a lady would complain is that she is having, the central parting is sparsing out, and she'll complain that, she can see a lot of, she's able to see her scalp more than the hair. So either it can be hormone dependent or it can be autoimmune, or they can be combined. So or there can be some systemic disorder also leading to hair fall. So that a doctor would examine, and we have a special lens with which we can see the kind of hair follicle, the number of hair follicle, by which we can actually understand which type of hair loss is the patient having. This is something called as dermoscope, which helps us in identifying the hair follicle and also seeing the follicle unit. So how many hair follicles present. So you switch on the light and you place this in front on the scalp, and then this can actually help you view the number of hair strands per hair follicle. So if you see fairly, she has a good volume, and I can see 2 to 3 strands every hair follicle unit. So these are basically baby syringes. If you see, they are very, the pain threshold is not much because the needle is very thin. So it really doesn't hurt much. So this is 1 ml syringe, so we take 1 ml of, or depending upon the amount of blood which we are withdrawing. So we keep on injecting onto the interfollicular area. Yeah. The scalp is already, the numbing cream is already applied, so it's not, you can see the patient is not even wincing. So it's pretty much comfortable treatment.
How many sessions like these need to be done?
So depends on the severity and grading of the hair loss. In my practice, I usually start with 3 sessions spaced at 4 to 6 weekly interval. So these are acute sessions, like when you give 3 sessions in 4 to 6 weekly interval. After that, there is maintenance session, which is at least 3 times in a year.
Okay. And does it have to be lifelong, or is it like a year-long thing?
It's a year-long thing.
So when can the patient expect to see results of the hair growth?
So the peak will be you'll start to see the result in a month, and maximum effect will be seen in 3 months.
3 months. Okay.
As I mentioned, there are a lot of growth factors present in the platelet, like platelet-derived growth factor, vascular-endothelial growth factor, insulin-like growth factor, transforming growth factor, fibroblast growth factor. So all these growth factors, basically your platelet is packed with growth factors.
So how would you decide which patient needs a hair transplant and which patient needs a hair PRP?
So if I tell you any patient who's needing to go for hair transplant, it is something we call it as like if the medical treatment fails, then only you go for surgical treatments. First, you have to give certain session of platelet plasma injection, provided the hair loss is not more than grade 4. If the patient is not having very severe hair loss or the hairline is not receding a lot, and it also depends on the patient, what is his requirement. If somebody wants a good hairline, then he is a candidate to go for hair transplant even before PRP. And PRP is something which we call it adjuvant therapy, where we, even if the patient is undergoing hair transplant, we always accompany PRP session pre and post.
Once your hair has grown, you've taken therapy, can you go back to your routine hair care like applying oil, or should one avoid those hair oil? Should one apply a certain kind of shampoo?
So very good question actually. What is happening nowadays, everybody's hair is colored, and the people who have straight hair, they want curly hair, and people who have curly hair, they want straight hair. So invariably, because of that, there's a lot of styling chemical which is everybody's hair is being exposed to. So the coloring is actually damaging your hair follicle, damaging the shaft. So you're having hair fall incidence increase because of that. And the grooming has really increased in India. I mean, really increased in India. So that's why what we see is that everybody who has a color hair and they're using their hair dryer, blow dryer every now and then. So that is actually damaging your shaft.
Even hair iron.
Hair iron as well. So that is hair iron is damaging even more than the dryer. So, and especially another thing is what few precautions which a patient can take if they are doing blow dry and stuff is that, you know, the cuticle is tied like this. So if your cuticles are, you imagine your hair cuticle are like this, and if your hairdresser is running his dryer in this direction, is going to damage the cuticle. So to run the direction in hair dryer in one direction is a brilliant idea. So if you have to go, still tell the hairdresser to run in a particular direction from up downwards, so that you don't damage the cuticle. The PRP cost varies upon the tubes which are being used, because the tube cost also varies. It also varies if you are using a GFC concentrate, because cost will be higher, 1.5 times higher than the PRP. Now the normal PRP treatment which you do, the cost varies for about 8 to 10,000 to 20 to 25,000. I'm talking
per
about
sitting,
standard.
per
Yeah,
sitting.
per sitting.
So which means that into 6.
Yeah, exactly.
So it's not covered by insurance.
It's not covered by insurance.
Because it's a cosmetic procedure.
Yeah.